Today we discuss about ventricles of the brain out of this third ventricle, and the third ventricle of the brain is cleft between the two thalami. This is a cleft between the two thalami, and this is the third ventricle. We can see this is the third ventricle, and it is continuous below with the fourth ventricle through cerebral aqueduct. This one we call it as cerebral aqueduct. We know that in the ventricles of the brain, CSF is present. In the ventricles of the brain, CSF is present, and this is the third ventricle, and here the anterosuperiorly this is the third ventricle. Okay, anterosuperiorly the third ventricle communicates with the lateral ventricle through interventricular foramen. Here we have lateral ventricle is present. It communicates with the lateral ventricle through interventricular foramen, otherwise called as foramen of Monro. So anterosuperiorly, the third ventricle communicates with the fourth ventricle, not fourth ventricle, communicates with the lateral ventricle through interventricular foramen, and it communicates below with the fourth ventricle through cerebral aqueduct here. And coming to the boundaries, anteriorly it is bounded by the lamina terminalis here. Anteriorly it is bounded by the lamina terminalis, and also anterior commissure. Anteriorly is bounded by the lamina terminalis and anterior commissure. Posteriorly we have pineal body is present, and also cerebral aqueduct is present. Cerebral aqueduct as well as pineal body, and also posterior commissure forms the posteriorly. Here we have pineal body is present. Posteriorly, the third ventricle, it is related to pineal body, cerebral aqueduct, and here we have posterior commissure is also present here. Somewhere here we have posterior commissure, and inferiorly floor it is formed by we know that floor is formed by optic chiasma. Here we have optic chiasma is present here, and so infundibulum, nothing but it lodges the pituitary gland, and infundibular recess is present here, is nothing but the extension of the third ventricle. And also we have mammillary body is present here, posterior perforated substance is present here, and also tegmentum of the midbrain. Tegmentum of the midbrain is present here. Tegmentum of the midbrain. Here is the tegment of the midbrain, and this is the pons. Okay, the floor it is formed by the optic chiasma, and also we have tubal cinerum, and also infundibulum which lodges the pituitary gland, and also we have mammillary body is present here, and this is the posterior perforated substance as well as the tegmentum of the midbrain. They form the floor of the third ventricle, and the roof it is formed by the fornix. Body of the fornix is this is the anterior column of the fornix, and this is the body of the fornix, and also tela choroidea, where the choroid plexus they are hanged on from the roof. We know that the choroid plexus produce CSF, right? And here, and also that's about the roof. And the lateral wall. It is formed by not lateral wall, the medial wall. The medial wall, and it is formed by the thalamus and hypothalamus, and between the thalamus and hypothalamus we have hypothalamic sulcus is present here. Between thalamus and hypothalamus we have hypothalamic sulcus is present here. So these are the boundaries of the third ventricle. So what is the function of the third ventricle? The third ventricle what it causes? It stores the CSF, it causes the production of CSF. The CSF is produced by the choroid plexus. The third ventricle communicates with the anterosuperiorly communicates with the fourth ventricle through foramen of Monro or interventricular foramen, and through the fourth ventricle communicates with the fourth ventricle through cerebral aqueduct. It is bounded anteriorly by the anterior column of pharynx, anterior commissure, as well as the lamina terminalis, and posteriorly by the posterior commissure, pineal body, and cerebral aqueduct. And roof formed by the column of the pharynx, and also tela choroidea, and the floor is formed by the optic chiasma, optic recess, and also infundibular recess, and also infundibulum, and here mammillary body is present, posterior perforated substance. This forms the floor, and here and the lateral wall is formed by the thalamus and hypothalamus. Both thalamus and hypothalamus they are separate. They are separated by a hypothalamic sulcus, which forms the lateral wall, of the third ventricle. Okay, so that's about the third ventricle. So lateral ventricles. The lateral ventricles they are situated in each cerebral hemisphere, and the lateral ventricles they communicate with the third ventricle through foramen of Monro, and the third ventricle communicates with the fourth ventricle through cerebral aqueduct. And the lateral ventricle consists of anterior horn, posterior horn, inferior horn and posterior horn. This is anterior horn. The area in front, this is the interventricular foramen. The area in front of the interventricular foramen is the anterior horn, and the area below is called inferior horn, and the area which extends up to the splenium of the corpus callosum is the posterior horn. Which extends beyond the splenium of the corpus callosum is the posterior horn, and the area in front of the interventricular foramen is the anterior horn, and this is the inferior horn, and the area which extends beyond the splenium of the corpus callosum is the posterior horn. Okay, and this is the body, Coming to the relations, this is the cavity of the body of the lateral ventricle. It is medially related to the septum pellucidum. The body of the lateral ventricle medially related to septum pellucidum and column of fornix. This is the column of fornix. This is related to septum pellucidum and column of fornix. Okay, and the roof is formed by the body of the corpus callosum, and the roof is formed by the body of the corpus callosum. This is the body of the corpus callosum. And here, and coming to the floor, roof is formed by the body of the corpus callosum, and the floor, it is formed by the caudate nucleus. And stria medullaris. And also we have thalamostriate vein. Thalamostriate vein is present here. Thalamostriate vein, and also upper part of the thalamus. Also floor. We have caudate nucleus is present here, and we have stria terminalis, not medullaris, it is stria terminalis, and thalamostriate vein is present, and upper part of the thalamus, they form the floor, and medially it is related to septum pellucidum, and this is the third ventricle. And this is the thalamus, and this is the upper part of the thalamus, forms the floor of the body of the lateral ventricle. So that's about the body of the lateral ventricle. Coming to the anterior horn, of the lateral ventricle, the roof of the anterior horn is formed by the corpus callosum, and coming to the floor, it is formed by the posterior upper surface of the rostrum of the corpus callosum, as well as the head of the caudate nucleus, and this is nothing but the cavity of the anterior horn. This is corpus callosum, this is septum pellucidum, and this is the column of fornix, and this is the anterior horn of lateral ventricle. And here we can see here the corpus callosum, it forms the roof of the anterior horn of lateral ventricle, and the floor, it is formed by the splenium of the corpus callosum, upper surface of the splenium and genu of the corpus callosum, as well as the head of caudate nucleus. And here we can see medially it is related to septum pellucidum and column of fornix, and this is the head of the caudate nucleus, which forms the floor of the anterior horn. We know that the floor here, it is also formed by caudate nucleus, and here the anterior horn floor, it is also formed by the caudate nucleus, and that's about the anterior horn. And coming to the posterior horn, floor and lateral wall is formed by the bulb of posterior horn, which is produced by the forceps major. This is the bulb of posterior horn, and the calvar, and it is also formed by the calvar avris, which is formed by the calcarine sulcus. Calcarine sulcus produces a bulging in the cavity of the posterior horn of lateral ventricle, and this bulging we call it as calcar avris. This is situated here. This is the cavity of the lateral ventricle, posterior horn of the lateral ventricle, and the roof is formed by tapetum of the midbrain, as well as the optic radiation. Forms the roof of the lateral ventricle posterior horn, and the floor and lateral wall, they are formed by bulb of posterior horn produced by the forceps major, as well as the calvar avris produced by the calcarine sulcus. Okay, and coming to the inferior horn, the roof, it is formed by the stria terminalis and also tail of caudate nucleus as well as the tapetum. The tapetum, they form the roof. And coming to the floor, it is formed by the floor as well as lateral wall. Floor and lateral wall, they are formed by the and coming to the inferior horn, the roof and lateral wall. The roof and lateral wall are formed by the stria terminalis, tail of caudate nucleus and tapetum. Here, this is tapetum. And coming to the floor, it is formed by the collateral sulcus here, which produce an eminence called collateral eminence, and also hippocampus. They form the floor of the cavity of the inferior horn of lateral ventricle, and we have choroid plexus is present here. So this about the inferior horn of the lateral ventricle. So the body of the lateral ventricle, it is bounded above. The roof is formed by the corpus callosum, and the medial wall is formed by the septum pellucidum as well as the column of cornix, as well as the floor, it is formed by the caudate nucleus as well as stria terminalis and the thalamostriate vein, and here upper part of the thalamus. And coming to the anterior horn, the area in front of the interventricular foramen is the anterior horn, which is bounded above by the corpus callosum and below by the rostrum and genu of the sphenoid as well as the head of the caudate nucleus. And here we have medial, it is related to septum pellucidum as well as the column of cornix. Here we have anterior commissure is present here. And coming to the posterior horn, floor and medial wall, they are formed by the fossa major as well as the calva ebris, which is produced by the calcarean sulcus, and the roof and lateral wall, they are formed by the optic radiation and as well as tapetum. And coming to the inferior horn, roof and lateral wall, they are formed by the stria terminalis and tail of caudate nucleus and tapetum, and the floor, it is formed by the collateral eminence, which is produced by the underlying collateral sulcus as well as the hippocampus. They form the floor of the lateral ventricle. So that's about the lateral ventricle of the brain. This lateral ventricle of the brain, it consists of CSF, and this CSF drains into third ventricle through foramen of Monro, and from the third ventricle it goes into the fourth ventricle through cerebral aqueduct, and from the cerebral aqueduct, from the fourth ventricle, it enters into the subarachnoid space through two foramen, that is foramen of Luschka and foramen of Mazzenti. Okay, we will discuss them, the foramen of Luschka and foramen of Mazzenti, during the ventricle of the fourth brain. So now we discuss about fourth ventricle. The cavity in the medulla oblongata is called fourth ventricle. It is situated behind the pons. The cavity of the fourth ventricle is situated behind the pons, and it is situated behind the pons and medulla oblongata and in front of the cerebellum. It is situated. This is the fourth ventricle, situated behind the pons, okay, and the medulla oblongata and in front of the cerebellum. And in the fourth ventricle, floor of the fourth ventricle is very, very important. So we will discuss about the floor of the fourth ventricle. The floor of the fourth ventricle, it is formed by the pons, dorsal surface of the pons as well as the dorsal surface of the medulla oblongata. The floor of the fourth ventricle, this is the roof of the fourth ventricle, and the floor of the fourth ventricle, it is formed by the dorsal surface of pons as well as the dorsal surface of medulla oblongata. This is the dorsal surface of pons and this is the dorsal surface of medulla oblongata. The dorsal surface of pons formed by forming the floor of the fourth ventricle is comparatively more when compared to the dorsal surface of the medulla oblongata, which forms the lower part. The pons forms the upper part of the floor and the medulla oblongata forms the lower part of the floor, and these two get separated by a group of fibers called striae medullaris, which are nothing but the fibers from the arcuate nucleus. This is called nothing but the striae medullaris. The pons and medulla oblongata, the floor which is formed by the pons and medulla oblongata, gets separated by a fibers called striae medullaris, which are nothing but the fibers from the arcuate nucleus, to the cerebellum. And here we can see here a dorsal median sulcus. A dorsal median sulcus divides the floor into two halves. A dorsal median sulcus divides the floor into two halves, and here one other sulcus is there, that is called sulcus limitans. Sulcus limitans is there. This sulcus limitans extended from a area, that is depression called superior fovea, and extends up to inferior fovea. So sulcus limitan extends between superior fovea and inferior fovea, and this sulcus limitans divides again the floor into medial eminence and lateral vestibular area. This is vestibular area and this is the eminence area, medial eminence, and this medial eminence it is produced by the facial colliculus, and this medial eminence it is produced by the facial colliculus. And this is the vestibular, and the lateral part we call it as vestibular area. And one more thing is, from the inferior fovea a line extends which divides the medial area into two parts, which divides the medial lamina into two parts. Upper area is called hypoglossal trigone and lower area we call it as vagal trigone. In this hypoglossal trigone, hypoglossal nucleus is present, and the vagal trigone, vagal nucleus is present. And just superior to the superior fovea, a pigmented blue color body is present. We call it as locus coeruleus. Locus coeruleus is nothing but consists of pigmented neurons which constitutes the substantia ferruginea. Locus coeruleus is present just above the superior fovea, and here we have inferior fovea and the sulcus which divides the medial eminence into two parts, upper hypoglossal trigone and lower vagal trigone. And here we can see in the lower part of the floor we can see it is formed by a tubercles of the gracile and cuneate tubercles. This is the gracile nucleus and the eminence formed by the gracile nucleus, and this is the cuneate nucleus. Gracile nucleus and eminence. Gracile nucleus and eminence. And this is the cuneate nucleus and eminence. This is the cuneate nucleus and eminence. Gracile nucleus and eminence, and this is the cuneate nucleus and eminence. So these are the forming the lower part of the floor. These are forming the lower part of the floor of the fourth ventricle. And here we have this is the middle cerebellar peduncle, and this is the inferior cerebellar peduncle, and we have superior cerebellar peduncles are situated here. And in the roof is formed by the superior cerebellar peduncle. In the roof we will able to see two lateral foramina and one medial foramina. These lateral foramina are nothing but the foramina of Luschka, and the medial foramina we call it as foramina of Mazzandi. So through foramina of Luschka and foramina of Mazzandi, this lateral ventricle it communicates with the subarachnoid space. What is subarachnoid space? It is space between the arachnoid membrane and the pyometer. We call it as subarachnoid space. In the subarachnoid space we have CSF is present, as well as some large arteries of the brain also present in the subarachnoid space. So the ventricles, the CSF from here it enters into the subarachnoid space through apertures in the roof of the fourth ventricle, that is foramina of Luschka, two lateral apertures that is called foramina of Luschka, and one median aperture that is called foramina of Mazzandi. So coming to the floor of the fourth ventricle, a dorsomedian sulcus divides the fourth ventricle into two areas, and also one sulcus limitans which extends from superior fovea and inferior fovea. It divides into medial eminence and lateral vestibular area, and the dorsal surface of the floor of the fourth ventricle it is formed by the dorsal surface of the pons as well as medulla oblongata. This area is formed by the pons and this area is from the medulla oblongata. Here we can see that the two areas get separated by stria medullare, which are nothing but the fibers from the arcuate nucleus. And here from the inferior fovea another sulcus divides the medial eminence into upper vagal trigone and upper hypoglossal trigone and lower vagal trigone. These are formed by the hypoglossal nucleus as well as the vagal nucleus respectively. And the sulcus limitans extend from the superior fovea to inferior fovea. Above the sulcus limita we have locus coeruleus is present. It is nothing but a blue colored body. It consists of pigmented neurons which constitute the substantia ferruginea. And here the lower part of the floor of the fourth ventricle it is formed by cuneate tubercle as well as the cuneate eminence and gracile nucleus as well as the gracile eminence or tubercle formed by the gracile nucleus here. And here we have another area, we call it as area postrema is present here. It acts between the gracile tubercle as well as the lower part of the dorsal median sulcus. We have area postrema is present. Area postrema acts as chemoreceptor, which acts as chemoreceptor. And coming to the roof consists of two foramens. So one is foramen of Luschka and foramen of Mazzanti, and through these two foramina, what happens here is the fourth ventricle CSF, it enters into the subarachnoid space, and here the fourth ventricle below, it is continuous with the central canal of the spinal cord. It is continuous below with the central canal of the spinal cord. It is situated behind the pons and medulla oblongata and in front of the cerebellum. So that's about the fourth ventricle. Floor of the fourth ventricle is very important.